Hello, good evening, sir.
Good evening.
I am Steady Lyngdoh, a second year medical student, and today I've been asked by the doctor to do the examination of the abdomen on you. So this required a various tests, and I'll be pressing on to different location on your abdomen. Will that be okay with you?
Yes, okay.
Okay. So before we start, I would like to know your name and your age.
My name is Stanistil Maroin. My age is 21.
Okay. So, sir, do you have any question before we start?
No.
Okay. And yes, we should not forget that before we start with this examination, sir, I require you to empty first your bladder. Okay. So after this, sir, I require you to lie in a supine position. Okay.
Okay.
To expose the abdomen, place the drape or sheet at the level of the pubic symphysis. Then raise the gown to below the nipple line, just above the xiphoid process. Sir, can I have your permission to roll up this shirt of yours?
Okay.
Okay. From the right side of the patient, I'll first inspect the surface, the contour, the movement of the abdomen. Also, I will note for the skin, include its temperature, color, scars, dry, dilated veins, rashes, and ecchymosis. And here also, I will note the appearance of the umbilicus if it is flat or inverted, and if there is any inflammation or bulges. And then I'll be observing the abdomen for peristalsis and pulsation. So after the inspection, I'll be auscultating, but before auscultating the abdomen of the patient, make sure that you should warm your hand and also warm the stethoscope for the comfortability of the patient. Here, auscultation is done before percussion or palpation because it may alter the characteristic of the bowel sound. So before I auscultate the abdomen of the patient, I would just like to name the 4 quadrants in the abdomen. This is the right upper quadrant, this is the right lower quadrant, this is the left upper quadrant, and this is the left lower quadrant. So I'll be placing my stethoscope on these 4 quadrants. This is for the normal sound. Normal sound consists of clicks and gurgles occurring at an estimated frequency of 5 to 34 per minute. Okay. Now for the bruits, I'll be placing my stethoscope over the aorta, the iliac arteries, and the femoral arteries. So now for percussion first, I'll be percussing in the 4th quadrant. Percussion helps to assess the amount and distribution of gas in the abdomen, viscera, and masses that are solid or fluid-filled and the size of the liver and spleen. And then I'll be percussing for the organ. Here, I'll be noting if there is any dull areas suggesting an underlying mass or enlarged organ. So next is for the palpation. First for the light palpation. So tell me if you feel any pain, okay?
Okay.
Can you please breathe in, exhale with your mouth open. Okay, do it repeatedly. Okay.
Here, I'll be identifying if there is any superficial organ or masses and any areas of tenderness or increased resistance to palpation.
Do you feel any pain?
No.
And for the deep palpation, here we require the patient to, with the legs flex and neck also flex. So can you please flex your leg and your neck slightly. Okay. Now the next examination is for the liver. First I'll be measuring the vertical span of the liver dullness in the right midclavicular line. So the vertical span of liver dullness of this patient is 7 centimeter, which is still normal. And for palpation, okay. Sir, can you take inhale and exhale? Okay. Wait. Okay,
Here, I'm
inhale.
trying to feel the liver edge
Exhale.
as it slides down to meet my
Again,
fingertips.
inhale. Exhale.
When palpable, the normal liver edge is soft, sharp, and regular with a smooth surface.
Okay. So for the hooking technique, sir, please inhale. Exhale. Inhale. Exhale. Okay. Again. Okay. Next, I'll be assessing percussion tenderness for the non-palpable liver. Okay. So next examination is for the spleen, and for that I require to go to the left side of the patient. So first I'll be percussing. Okay. So to check for the splenic percussion sign, I'll be again percussing. Sir, can you please take a deep breath? Okay. So now for palpation. Okay. Sir, please take a deep breath. Again. Again. Okay. So sir, can you roll to the right a little bit? Okay. Again, sir, can you please take a deep breath? Again, release. Again, release. Again. Okay. Okay. So after the spleen, the next examination is for the kidney. So first I'll be palpating for the left kidney of the patient. So here I'll be noting if there is any mass. Okay. A normal left kidney is rarely palpable. So now I'll be doing for the right side. Right kidney is usually tender, and yeah, and it is usually palpable. Okay. So So now for percussion tenderness of the kidney. Sir, can you please sit, okay? Okay. So now for the aorta, I'll be pressing in the epigastrium region. So now for the special technique, first I'll be assessing for the possible ascites. So here there are two techniques which help to confirm the ascites. First is the test for shifting dullness and the second is the test for fluid wave. So first I'll be doing the test for shifting dullness. Okay. And sir, can you please roll to the right side a little bit? Okay. Okay. So now for the test for fluid wave, sir, can you please keep your hand like this? Okay. Okay. So lastly, I'll be assessing for the if there is any appendicitis in this patient. So sir, tell me when you if you feel pain, okay? Do you feel pain?
No.
Okay, again I'll do it.
No.
Okay. So with all this examination, I finished the abdominal examination. So thank you.